Thank you, guys. That's been really, really good. Really appreciate it. Okay, so first thing we're going to do tonight is go back in time. We're going to go back to 1997, to the birth of FDS, or actually the prior to the birth of FDS, because this program that we're going to watch a brief 10-minute segment from was really the catalyst that got FDS going. And my appearance on that show then drew a lot of telephone calls from family members, which led to the public meeting in Ashfield Uniting Church, and the rest, as they say, is history. And we're still here 16 years later, and we still have drug issues. So we're going to look at what the issues were in 1997, and then Paul's going to lead this incredible panel. I think we're so fortunate to have got the panel of this caliber together. Although I do notice it's a little bit gender biased. I'm sorry about that. But yeah, and then we're going to look at what the scene is then in 2013, what's changed, what still needs to be changed. So we start with the video, and then I'll hand over to Paul.
Hello and welcome to Witness. I'm Paul Barry. Thanks for joining us. Tonight, a special program that explodes the myths of a modern tragedy.
Cabramatta 62.
Unconscious overdose patient.
It's out of control. It affects all of us. Tonight, the heroin crisis. Damien Trimmingham was an achiever, a sporting hero from the right side of the tracks. But at 23, Damien was dead in an alley.
I mean, this is not the place that he should have died.
Our homes are no longer safe because of heroin.
Well, I've been robbed 5 times, twice last year. And it's a horrible feeling to come home from shopping and the door smashed in halves.
You're under arrest for possessing the heroin?
I'd go and rob 3 to 4 houses a day, and it'd cost me about $800 a day on heroin.
People need to understand that there is no family in Australia that might not be touched by this scourge.
How many of our young people does it take to die from a heroin overdose before our politicians recognise it for the national crisis that it is? Where else is 500 deaths a year not considered enough? As you'll see tonight, heroin addiction is not confined to prostitutes and street kids. Its deadly effects reach into every corner of our society. It might be your lawyer who's shooting up, your daughter's teacher, your son, it may even be you. Later on, I'll be speaking to a group of people who've all experienced firsthand the destruction wreaked by the drug. Among them, Tony Trimmingham. His son Damien came from what we'd all call a nice middle-class family. Damien was a sporting hero, an achiever. His father was proud. But at just 23, this golden boy died at the point of a needle. In February this year, 23-year-old Damien Trimmingham injected himself with heroin and died alone in the stairwell of an empty inner-city building.
My grief just goes on. I wake up every morning and the first thought that hits me in my conscious state is Damien's dead. I sometimes have dreams of Damien still being alive, and I wake up to the reality of the nightmare.
Damien's the sort of person that was there for literally anybody.
4 months after his death, Damien's mates are still struggling to accept the way he died.
You know, this great man dying in a car park, you know, this is such a great person, and you just don't hear about it.
I never knew that Damien was on it. You see, there's a lot of parents out there who wouldn't know their sons are on it, or daughters who were on it.
No question it's a real demon, because once it takes grip, although Ben was only involved for about 4 or 5 months. But he really battled. He knew what he was up against, but it's...
The myth that heroin is simply someone else's problem is shattered by those sitting round this table in Sydney's affluent North Shore. Katie lost her son, Sam, in February this year, the same month that Damien died. Whilst 4 years after Ben overdosed, his family are still grappling with the sorrow and the stigma.
You know, I think so many people feel that kids who take drugs are bad kids, or kids from families who don't love them and care about them, and nothing could be further from the truth.
If you've ever had your VCR stolen, your car pinched, or your insurance premiums have risen, you can probably blame it on heroin. Yet remarkably, we couldn't persuade a single minister for health, justice or police at state or federal government level to take part in this debate. They all claim they have more pressing things to do. Well, Tony Trimingham, I wonder what message you get from politicians that they don't want to talk about your son's death and what might be done about it.
I guess I get the message I've been getting for the last 3 weeks. I've been trying to contact various members of the New South Wales state government and federal government. And I know where they are today. They're sitting on the fence. The question I want to ask is, why aren't they here?
But I think that governments, health and police ministers, families have been affected, and many of the people in this room could and should come together at a national level to have a look at what we have done and perhaps what we ought to be doing in the future.
Your son, Ben, died of a heroin overdose. Would education have made any difference to him, or would anything else have made any difference to him, do you think?
Well, I think you always have to consider the indestructibility that youth feel, that there's always this invincibility. But certainly, I think that we have as a society a responsibility to look after our youth, because they're always going to take risks. Certainly if there was some decriminalisation, I'm sure Ben would have been alive.
But is there a better way of educating, a way of getting that message across better than we do at the moment?
I've been in this for nearly 30 years, and 20 years ago they were saying, decriminalise it and you open the floodgates. A big crisis for me is to realise that the floodgates are open now, and that is a major crisis, and I suspect that's why so many politicians are not here, because the more you look at it and the more you study it, the more you realise it's failed. And yet they're too frightened to say, look, the only way to go is decriminalise it, and then maybe we can get some controls on it. But they think that that's going to be unpalatable. It needs to be decriminalised because there's no other way.
Look, we'll come to an opponent of that in a moment, but I just want to take in Nick Pappas here. Now, you were a magistrate, chief magistrate in Victoria.
Yes, Paul.
And you came to believe what? In legalisation, decriminalisation?
Decriminalisation. I was sending people to jail who were drug users, who were ill. I send them to jail, and they get drugs in jail. What's happening? How can we prohibit drugs on the streets when they can get them in jail? We've lost the battle. We need to find new solutions, and one of the solutions we have to find, I think, is going to involve completely lateral thought. Now,
Brian Waters from the Salvation Army, I know you are an absolute opponent of decriminalisation, is that right?
Yeah. I hear people saying here that prohibition, which is a very emotive word, has not worked. Now, I've just read the latest figures that have been available from the National Drug Survey, the household survey, that showed that the incidence of heroin use in Australia dropped 60% in 2 years.
Well,
now, it's a very...
Advisory Council says it's gone up by 6%.
They're not my figures, they're the National Drug Strategy figures. And let me, the household survey...
Well, I don't know that anyone else would agree with those. I mean, the number of overdoses rises constantly.
I didn't do the survey, that's an official government survey.
If you don't believe the figures either, then why quote them?
Let me say this.
Does anybody here believe those figures?
No. It's a spectacular and sensational problem.
That if we decriminalise, people are going to go and take drugs is a nonsense. If people want to take drugs, they can go and take them. They can walk out of the studio, down the road, and find somewhere to buy drugs. What we want are drugs that are available, under control, and healthy.
This is the heroin trial in Canberra in the ACT. Now, you are the person really who's got that as far as it has got. Why did you push so hard for it?
I was in the fortunate position of chairing a select committee that looked at drugs. When I went into that committee, I was a prohibitionist. When I came out of it, like has happened with almost all of the 25 parliamentary committees and government inquiries over the last quarter century, I came out of it and said, this is not working, we have to try something else.
The thing that worries me with the heroin trials is the wrong message to kids. Because as soon as you start giving it away and allowing it to be used, That message, if you give a child a centimetre, it'll take a metre. If any parents here know that, we have to be so careful. I'm not prepared to take that risk.
Mr. Owens, you are a power in the New South Wales Drug Enforcement Agency. Will you take a look at that for me, please? Do you know what that is?
Well, it appears to be balloons similar to what are sold out of Cabramatta.
It is, in fact, heroin. It's heroin bought out of Cabramatta. This is supposed to be illegal. We've bought that with the greatest of ease. Prohibition has coincided with a huge increase in the use of the drug, huge increase in the number of overdose deaths. What do we do instead?
I haven't got the answers. Obviously, when things aren't working, there's always things that you can do better. It is an extremely difficult job. Supply control was a philosophy that was come down with the National Drug Strategy. Clearly, that is not working on its own. We in New South Wales are looking more to implementing the harm minimisation aspect as well, and really these two need to be run hand.
I think what we're talking about here, and it's a very naive society that thinks that if we can get rid of the heroin program out of the criminal hands, they won't sit back and create something else that's even more dangerous that our kids will get involved in. That's a very naive approach. We have not brought in really, truly significant drug laws, as was brought up here.
So what are you suggesting? Death penalties for drug traffickers like Singapore?
No, I'm not suggesting that at all. It's a two-way...
How tough?
Okay, very tough.
I'm listening to an awful lot of people who are passionate about this debate and who've got a lot of good ideas. The whole thing boils down to the fact that between the time your program contacted me and the time I came over here, there would have been 3 or 4 more overdose deaths in Australia. We are mucking around while there are preventable deaths happening every day. There are a lot of things that need to be done. Education, I agree. Rehabilitation, I agree. Law enforcement, I agree. The lady with the summit in the front there is a great idea, but let's get on and do the darn thing now.
We're talking about a national summit. No one mentioned that drug users should be at that national summit, should be saying what their needs are, what's going on for them. Drug users make choices. They make choices in all aspects of their life. Just the choice to use drugs is a very serious choice.
Annie, you are a user yourself?
Yes, I have been using.
But that's really scary.
And you have a job?
Yes, I run an organisation. I have a degree, an honours degree. I'm currently studying for my master's degree. I do not smoke cigarettes. I do not drink alcohol. I don't take any other drugs.
But why use heroin?
It is a drug of relaxation, of recreation, to use socially. I mean, there's lots of reasons. Lots of people use drugs for fun. I think we have to accept that.
Andrew Phillips. And that's it for tonight's special programme, Heroin the Crisis. Thanks for joining us, and many thanks to our audience here tonight, who've tackled the issues our politicians shy away from. Perhaps now they will find the political courage to climb down from their moral high ground and do something positive and effective to stop heroin claiming more lives. What I'm going to do first of all is to introduce some of the panellists. Superintendent Frank Hansen. Frank, I don't know you. Yeah, Frank, okay. He was the New South Wales Police Force for 40 years until he retired in 2010. Spent 15 years in drug enforcement. Local area commander in Cabramatta for 2 years, and then commander drug and alcohol coordination for 8 years. So as far as the police are concerned, you don't get much more experience in drugs and alcohol than him. He provided policy advice to the New South Wales Police Force and government on alcohol and other drugs, particularly relating to police practices, and he's been on numerous state and national committees representing the police. While we're about it, I'll introduce Clive Small. Yes. Clive is another policeman, 38-year New South Wales Police veteran in the force for 38 years. Had a famous, stellar career investigating crime, including the backpacker murders, but also organised crime and drug law enforcement. He also worked as an investigator with the Woodward Royal Commission into drug trafficking. And in 2001, as head of the Greater Hume Police Region, he helped dismantle the Vietnamese street gangs that made Cabramatta Australia's heroin capital. After retiring from the police, he joined the New South Wales Independent Commission Against Corruption as the Executive Director, and since then, since 2007, he's been writing full-time. One of his books, Smack Express, exposed the growth and transformation of organised crime in Australia. Another, Blood Money, Bikies, Terrorists and Middle Eastern Gangs, so he knows a fair bit about organised crime and drugs. Alistair Laurie. Alistair's been Policy and Media Officer at Hepatitis New South Wales since November 2012. He's prepared recent submissions on compulsory drug and alcohol treatment laws and the National Aboriginal Torres Strait Islander People's Drug Strategy. He's worked as advisor to 2 federal cabinet ministers. He's also a long-standing involvement in social justice campaigning, including on lesbian, gay, bisexual, transgender and intersex human rights. Nicholas Cowdery, I'm sure people will know. Yeah. Should put you on a podium. Director of Public Prosecutions in New South Wales from 94 to 2001. Constant. 2011, beg your pardon. I can't read. Constant thorn in the government side. That's right, isn't it? Yeah. No, we got that bit right. Former President of the International Association of Prosecutors, inaugural co-chair of the Human Rights Institute of the International Bar Association, now an adjunct professor of law and visiting professional fellow, consults with prosecuting agencies in developing countries, a member of the Australian Drug Law Reform Initiative at the University of New South Wales. Nikki Bath. Nikki. She's currently CEO of the New South Wales Users and AIDS Association, an advocate for health and human rights of drug users. Her background is in policy analysis and research both here in the UK, and in her time she's headed up the Alcohol and Other Drugs program. She's been the Policy and Treatments Manager for the Australian Injecting and Illicit Drug Users League and manager of the Healthy Options team, which was a unique and innovative user-led harm reduction service in East London. Matt is the co-founder of Street Universities and acting CEO of the Ted Noss Foundation, which has created world-class drug treatment centres, youth centres, intervention and counselling services, a research centre and a software division that works with half a dozen other drug services, including WHO's, what's that? Who's, beg your pardon, Who's, and Odyssey House. Peter Slattery. Peter, right, he's hidden behind the mic there. Peter works with young people, especially those having a hard time in life, also with their friends and families and communities, and he trains and supervises professional workers who deal with those young people. Now, we've still got a few more. Who have we got left? Brian Carlton. Brian Carlton's been in radio since he was 21, which is a couple of years. Till the end of 2008, he was a talkback presenter on Triple M, using the moniker The Spoon Man. He now hosts a new show on News Talk 2UE called The Stir with Brian Carlton. And it's called that because he's opinionated and emotive and gets listeners talking. Sometimes he'll shock, sometimes he'll surprise. What he'll never do is be boring, says his. So we'll hold him to that.
Also.
Gino Bumbaka, is that the correct pronunciation? Gino Bumbaka. Gino is the Executive Director of the Australian National Council on Drugs, and he has extensive experience in HIV and drug and alcohol fields in Australia and internationally. His work has been within health and prison departments and in a variety of drug and alcohol centres, where he assisted with the operation of the first needle and syringe program in Australia and oversaw the introduction of Australia's first condom distribution program in prisons. He also advises on prisons, HIV and drug issues for international organisations such as the UN. Dr. Alex Wodak, the name most of you will know, I would have thought, was Director of Alcohol and Drug Service St Vincent's Hospital, Sydney, for 30 years until 2012. He worked with others to establish Australia's first needle syringe program and Australia's first medically supervised injecting room, when these were both, and I love this expression, pre-legal, which is like illegal, really. Dr. Wodak is courageous. President of the Australian Drug Law Reform Foundation and was the President of the International Harm Reduction Association from 1996 to 2004. He often works in developing countries to help control HIV infection among drug injectors. And Rod McQueen. Rod McQueen is a doctor who spent many, many years in general practice in Orange, also doing work in mental health and drugs and alcohol. He's also a specialist in drugs and alcohol, and for the last 7 years he's worked full-time with the Linden Community, which is an NGO based in Orange, which runs a detox service, long-home rehab and support service in Aboriginal communities. He remains optimistic that change can occur, but notes that doctors today are still part of the problem and rarely part of the solution. Now, I had this one person I haven't introduced here at the back. Who? Debbie. Family Drug Support. Family Drug Support, right. So you probably know her. Okay. And I'm sorry. Where are you on here?
Apparently not, Brian. You can introduce yourself. I'm able to say...
My apologies.
Greg Chip is my name. I'm president of a political party called Drug Law Reform Australia, and we've recently formed, we'll be contesting the current election on a platform of drug law reform.
Thank you very much. I'm sorry not to introduce you. You're not on my list. I'll remedy that. Okay, so, and Tony Trimmingham you all know. So look, maybe we'll start with Tony. What has changed in, what, 15 years, 16 years since that program went to air? Has it got better or worse? Has anything much changed, apart from the fact we've all got older?
I think a lot's changed. Certainly, looking at the positives, I think there has been more money available for treatment and for drug services generally. Still far, far too little, but better than it was. I think from our particular angle, people are aware of families now. They weren't back then. We were insignificant, we were unimportant. Again, though, we don't get the resources that we need. The drug trends have changed, of course. After the heroin shortage in the year 2000, there was an improvement in uptake of our heroin and problems from heroin, and particularly deaths. In the program, you mentioned 500 deaths. I think that was the 1994 figure. 97, when that program went to air, the figure had risen to about 600 or 700, and it reached a peak in 2000 of 1,100. The figure I always quote, though, which I think is significant, is that since my son died in February 97, 10,000 young Australians have died from heroin alone, and most of those are under 40. There's a lot of other things, but I'll let other people mention some of the other changes.
Maybe I'll ask James. James, is heroin still the main problem, or has the centre of gravity moved, or the centre of concern moved?
I think it definitely has moved as far as we're concerned. Over the past 3 to 4 years, certainly, that our biggest drug, people nominate as their primary drug of concern to be alcohol. And so that you have kind of a fluctuating, identification of primary drugs of use between heroin has dropped significantly. Certainly methamphetamine or ice or amphetamine type substances certainly feel devoid for a period of time when heroin became less available. The other issue, though, even more, which complicates all of the drug use, is the fact that over the past 7-8 years, we've had a continual increase in the number of people who not only have problems with drugs, alcohol and drugs, but certainly have mental health problems. And I think for all treatment agencies, that's probably the most challenging aspect of providing services right now. Because you're kind of caught between, one, as Tony said, we never get enough resources. That's okay, we've learned to live with that. But then you also add on to that like another, morbidity that you have to deal with, where in a lot of cases there's also no resources, to deal with that as well. So it's become very challenging.
Look, I want to ask this question to everybody, because if the problem is now more alcohol than anything else, is it any longer particularly relevant to be talking about legalizing heroin or legalizing other drugs? Is that still an important issue for everybody on this panel?
I think it's still, look, every day, and I mean increasingly, and particularly over the last 5 or 6 years, anytime you pick up anything, any correspondence, any listserv that has to do with alcohol and drugs, you see increasingly a number of initiatives in different countries in terms of decriminalizing drugs. Certainly just last week, I guess Uruguay is going to legalize marijuana. And certainly there's a growing, it's a kind of a groundswell where that certainly is one of the primary things on the landscape.
Okay, let me give it to you, Nick. You have a say on that. I'll grab that other mic. So what do you reckon on that, Nick? Is this still an important thing for you, reform? Law reform?
Yeah, I think law reform is still very much on the agenda because although alcohol might be taking over in terms of numbers of users, quantity of use and degree of problem making, the other drugs are still there, the other drugs are still being used, and the other drugs, particularly amphetamines and heroin to the extent that it's still being trafficked, is in the domain of criminal gangs. Bikies in particular and other gangs are making illegal profits from the peddling of drugs, and there has to be some development in our thinking about the issue to attack those profits and the antisocial activities that go with it. And that's why I'm very much in favour of legalising, regulating, controlling and taxing all drugs, as we do at the moment with alcohol and nicotine.
Can I get a view from one or both of our policemen on that? Whether that's something that you would like to see?
I'm happy to make a comment. I disagree with the point of that legalising the drugs will solve the problem. It won't. And I think you need to think the argument through. And if I can for just one moment, let's talk, say, it doesn't matter which drug you pick, but let's say cocaine. We are going to legalise cocaine. Where are we going to get it from? We don't grow it in Australia. We couldn't grow it in Australia. We're going to have to go to South America and buy it off terrorist groups or narco-terrorists. So what we have is a government dealing with a terrorist organisation, or we have businesses in Australia who are supplying illegal product, cocaine, buying it from terrorist groups, and our government's permitting it. And those terrorist groups are trying to overthrow the countries where the drugs are being grown. Now, if you're happy with that, that's fine. But when the terrorist groups then come to Australia and say, hang on, we can make a bigger product by not dealing with legitimate business, but by transporting the cocaine from South America to Australia and selling it ourselves. In South America, we sell it for something like $3,000 to $5,000 a kilo. In Australia, we can sell it for $240,000 a kilo. Let's make a bigger profit. Let's say we set up a terrorist organisation in Australia that's selling legitimate products. Now, you can apply that principle to every
Quite a lot of
drug.
these drugs are actually, you can manufacture synthetically, couldn't you? You can manufacture a substitute.
Well, I'm saying, let's go through it one at a time.
Yeah, but that would solve the problem of dealing with a terrorist organisation. This is entirely hypothetical, but you could presumably manufacture them synthetically and distribute them in that fashion.
And then the second problem is the government says, well, this is a product that's selling well, we need to tax it. So the 250,000 all of a sudden becomes 400,000. And it's sold synthetically produced. The criminals aren't going to give up. They can say, listen, we can make a better product.
But you don't have to do that. I just don't accept that, Clive. I don't think that's right. I don't see why it needs to be such a profiteering. If it's reasonably cheap to make, it doesn't have to be sold at 200,000 and give a huge opportunity to criminal gangs, surely. Alex, sure. I don't want to get into an argument with Clive about this, but let Alex do it.
Let me make a quick response to that, and that is that cocaine is available in Australia today, medicinally, lawfully, and the nearest suppliers, I would guess, from where we are now, is the pharmacy of the Royal North Shore Hospital. They would certainly have it, and they would use it for ear, nose and throat operations. In England, it's been prescribed to drug-dependent people and dispensed to them by nurses and pharmacists. So these problems aren't as unimaginably difficult as Mr. Small mentions, because we're already doing them around the world. The Coca-Cola company buys cocaine from South America and uses it in its products, not as cocaine. Coca-Cola did contain cocaine until 1903, and then it was transformed into another substance. But I think there's a bigger point that really needs to be made, and that is in the 16 years since the film was made, apart from us all getting 16 years older, the other thing that's really changed is that the debate about this subject is really essentially over. The debate that the war on drugs works is finished. It's been a comprehensive failure, and almost everybody now accepts that. And we're now moving from the debate phase to the political phase.
I'm not sure that Tony Abbott or the Liberal Party, or in fact most of the Labor Party, the Labor politicians would accept that.
Well, I'm talking about people who take an intense interest in this. We've had...
Yeah, but I think you would have said that 16 years ago, Alex.
Well, what's different is that we've had two states in the United States, Colorado and Washington State, voting 55 to 45 to tax and regulate cannabis on the 6th of November last year. We've had the decision in Uruguay that's been mentioned, 50-46, that was taken on July the 31st to tax and regulate cannabis in Uruguay. We've had a decision in New Zealand, 119 to 1, the Psychoactive Substances Bill, on July the 11th,
to start regulating synthetic drugs. So there's a huge movement.
Let me throw it over to a few more people, and I'm not going to be able to pick you all out. But just hold on a moment. No, because is there a difference between cannabis and the other drugs? I mean, could we legalise them all? And once again, would it solve some of the problem, part of the problem? What would it do?
May I say that clearly, you asked a good question there. Drugs are all different. It'd be mad to scoop coffee in with heroin. So
that's legal anyway.
Legalising drugs, and legalising goes with regulating. Nobody's saying, as Alex has been heard to say, that you should be able to buy an ounce of heroin at the supermarket. This is the argument, the rational adult discussion we need to have. And with respect, I'm just flabbergasted that someone could put such an inane argument that, and let me paraphrase, which is possibly unfair.
Try not to be rude.
If we legalise drugs, the government will then have to buy drugs from criminal organisations, which clearly would not be criminal if drugs were legalised. So you've got a total hypothetical argument, a constructed argument to protect the status quo.
Well, the current suppliers of cocaine are all illegal, so if you were buying them from them, unless you were making the stuff yourself, you basically would, surely.
Against legalising drugs, that if they were legalised, and let's do cocaine, sure, but again, the same premise, if you legalised marijuana, the people that grow marijuana would not be criminals. And Alex points out the moves that are happening in America to codify the legalisation of drugs. And legalisation is where we need to go with this, to take the criminal element out, to save lives, to save our young people that are sucked into harder drugs because of that connection between the soft drug market, let's say, and your narcotic markets. So each drug should be kept separate. There should be separate regulations for each drug. But the solution, and this is where Drug Law Reform Australia...
But all should be legalised. But all should be legalised.
With regulation, and here's the trouble. Legalisation is not a frightening word. We've legalised prostitution.
Okay, let me just ask, I know it's a very crude thing to do, but can I get a position from all of you on whether it's a good idea to legalise and regulate? Does anyone not think it's a good idea? Or does anyone think it is a good idea?
I don't think...
You don't think it's a good idea? Anyone else?
No, I don't think we're thinking about the legal system in the right way. The legal system can be used, apart from putting people in jail, it can be used for things like regulation, coercing people into treatment and so on. And I think that's where the problem is, and that's the difference I have.
Well, decriminalising we're talking about, aren't we? Primarily. No? No?
What I'm saying is we need to think about the legal system in a modern way.
Sure, but I think your co-panellees are thinking about decriminalising and legalising. I mean, I don't know, is that right?
Isn't the problem here one of definition? What are we actually trying to achieve? The prohibitionists, like Clive, and I respect his many years in the force and all the work he's done, but the position from the politicians and the police has been to eradicate drugs. And that's where the prohibition model has clearly failed. Right. I think what we need to do is define what we're actually trying to achieve here. Is it a cessation of all drug use? I think most people would argue that that is impossible. Under any circumstances is impossible.
Yeah.
On that basis, we then need to come up with some kind of structure, legal framework, obviously. It needs to be a global legal framework that sees the substances controlled to the extent that they minimise the harm done to the users and also to the broader community. I deal on a daily basis with drug-related crime, the victims of drug-related crime, people who have absolutely nothing to do with heroin or cocaine or ice or any of the substances that are so inherently, potentially dangerous. My position, and I've been arguing this fruitlessly on the radio for 23 years now, much to the chagrin of management and colleagues, is simply, when you mention the word decriminalisation, the public freak out. The public hear that because of the prohibition messages for 40 or 50 years now as open slather. The position I've been arguing for a long time is to, as Nick was saying, to control, to regulate, and to distribute under a controlled set of circumstances where there are other services available to the people who use. Now, the kind of thought bubble I've come up with over the years is a
a series of almost government shops, regulated shops, where a user registers. You can't drug shop, so you can't go from one place to another. There is a limited amount available per visit. There is counselling there. There is health services there. People have access to plug into many of the organisations that we're dealing with here. The prices, because it is it costs, the last I heard, it costs about $1 to make a gram of heroin. About $1. The actual grow the plant, production costs, etc. If we could get it to that situation, we might be able to control the use of the substances and minimise the effect on the people. But at the moment, it's an either open slather, deregulate argument. That's how the public hears it, whether that's the way it's intended or not, as opposed to the prohibitionists who want to simply wipe out drugs. Our starting point has to be that's impossible.
Do you think we're getting any closer to that being practical? What's the feeling on the panel here about whether that is... I mean, clearly, according to Alex Wodak, and I'm sure it's right, that those who are involved in this field now don't believe there really needs to be a debate, that the way forward is obvious. Do you think that the politicians are anywhere near being convinced of that, or the communities anywhere near being convinced of that?
I think the politicians aren't, and I think the community are on the way. And I mean, for a long time, I'm looking back at that film was interesting because I said a lot of things then that I've stopped saying because we are funded by government. We have this attitude that we're facing, and there's a lot of families here in the audience, and I know that for us, drugs have been a really problematic thing that we've had to deal with. But I'm ready to speak legalisation now. I don't think it is something that we have to be frightened of. I think it can happen. We have legal drugs already that are quite harmful. So I would legalise them all, and but in that there would probably be some products that you wouldn't allow. You'd have a process where you quality control them, and people would have to stand up and be counted for their products. Some of the synthetics, for instance, we hear about and not good, and we shouldn't allow them loose on anybody. But other drugs, I think, with regulation, we could do it. And we would have so many more resources, because at the moment we pour in 80% of all our resources into supply reduction.
Frank Hansen, what do you think would be the police response to that? And what would be your response to that?
I think in recognising that people, as we've said here, continue to use drugs, I think we've also recognised that perhaps it will be some time before the status quo becomes altered. My continuing concern is to ensure that those who are using drugs and who intersect with the legal system or intersect with the police and the legal, as they most frequently do, that legal system provides support to those people in getting access to health services. And I think, given even the current legislative structure that we've got at the moment, I think we can do that better. And you say what might have changed since that video was made. One thing that did change was the threat of HIV. And that made a lot of people, including the police, sit up and take notice. And it was the introduction of things like the needle syringe program, methadone program, which had surprisingly considerable support from the police, which often is not always seen to be the case. I think we can do things better for those who happen to be using drugs and have the legal system as it stands, I mean the whole legal system, support those people and get them assistance, get them treatment, as opposed to the alternative.
Do you think it's doing a better job than it was 15 years ago, the legal system, in pushing people towards treatment rather than to punishment?
Well, not necessarily pushing them, but giving them access. Now, I think all those years ago there was a fairly hard line taken, and that line's dictated by government, it's dictated by laws, it's dictated... But there's been a little bit of an opportunity has crept in over those years, such as cannabis cautioning, such as
the needle syringe program, and a change from a policing perspective of a realisation that we can actually assist in getting people into treatment. We could do better, but I've been involved recently in a law enforcement an HIV network, which is an international network of police. They've got 4,000 fairly senior police across the world now who have signed up to this network, who are encouraging exactly that, encouraging within the current, whatever their current legislative structure is in those countries, and including Australia, getting better access to those for those who are seeking treatment, whatever that might mean, but allowing people to get better access to health services when they want them, and certainly not having law enforcement deter them or prevent them from getting that treatment. And I think that's an important position that we've come to since that video.
Alistair, you've advised a couple of cabinet ministers on drugs, presumably on drug policy.
One indirectly, yes.
What's their reaction when you suggest things like maybe it'd be a good idea to soften the regime or abandon prohibition rhetoric?
I'm not going to comment on those politicians in particular, but I think there's a tendency of all politicians to run away from hard problems like this, and nobody is going to say that taking that decision is an easy one, even though most of the people on this panel, myself included, think it's the right one. So I think that it would be a courageous thing for a politician to do. We just hope that we find a courageous politician to do it.
Clearly, if you legalise, there's likely to be an effect on reducing crime if it works, I would imagine. But is it going to help the users of drugs? I mean, James was talking right at the beginning of how the latest problem that he sees most of all is alcohol misuse, which is a legal drug. Why would legalisation help the users in any way? Anyone tell me that? Yeah, Nikki. Is it Nikki?
Thank you. It's interesting listening to the various comments from the panel. I watched the clip and it was fascinating. I moved to Australia in 2000, and so it was, I hear a lot around the sort of history, and then watching that and seeing some very familiar faces there, I just felt like I could be watching that programme today. And while there have been these changes, the reality is for many people who are dependent on drugs, for people who are injecting regularly, life is very difficult. And one of the things that we see as a result of prohibition is the criminalisation and marginalisation of a group of people. And from that we see high levels of stigma and discrimination from the community, which then results in acting as barriers to services, people being able to talk to their families through their networks. And the Australian Injecting and Illicit Drug Users League recently did it was a marketing survey with the public, and it was really quite shocking to see the response from the community about attitudes towards people who inject drugs. And the report in itself is called "Why Wouldn't I Discriminate Against Them?" and that was the tone of the report and what came from it. So regulated drug markets will start to reduce the marginalisation, the criminalisation, the stigma and discrimination, so that people can live healthier lives and live for longer. And I think we're in interesting times today when we are seeing the banning of these emerging the emerging synthetics, and not taking the approach that New Zealand's taken, which is to look to see how they can regulate these drugs. I learnt just today that there is one new synthetic being created in a lab a week in Europe at the moment. We don't know what are in these drugs, and if we had regulated markets, we would absolutely see that market disappear, because people don't really want those drugs. People would like to be able to buy MDMA, ketamine, cocaine, heroin, and so we're seeing these emerging markets as a result of prohibition. What we'd also be able to do as a result of regulated markets, of course, is much more improved, open, honest, drug education for people who use drugs, peer education by drug users, because it won't be so awful to stand up in public and say, I am somebody with a history of illicit drug use.
Does anyone disagree with that? I can ask James in particular whether you feel there is a difference in the way that the people in your program who are on alcohol as opposed to injecting drugs are treated and stigmatised?
I don't think. I think one of the issues that, and I was just thinking about not only that program, but certainly when we had the drug summit in 1999, and when the injecting center got approved, tacitly approved, was already approved, and one of the difficulties that you're always going to have, I think, is certainly if you look at, where do you get leadership on issues where you talk about, you hope that you get leadership from the politicians, and very often that doesn't happen. And so consequently you have a vacuum that's created where whoever has the loudest voice to kind of put something down, whether it's shock jocks or whoever the case may be, that's who people listen to, the public listens to. And so they formulate their opinions on what might be the real issue based upon what Alan Jones might say or whatever Ray Hadley might say, because everybody's creeps and they're this and they're that, and that's how they formulate their opinion. And so the real test and the real challenge, for all of us, whether or not you favor certainly decriminalization or not, is one of the things that you want is for people to be treated as people. So that, irrespective of whatever it is, that let's say you're a crook, let's say you're a criminal, so even if you're a criminal, then the test for society is how well do you treat the people who are less, enfranchised than everybody else. So if those people get mistreated or they're seen as being not welcome, not as good as, we really don't want to do anything, then we can have a continuing problem. If, in fact, going through the steps, and I think that this is something that all of us have to recognize, from where we came and where we are now, we've made some significant progress. On the other hand, if you're saying the whole idea about whether or not society is going to holus bolus, embrace decriminalization, legalization, that's not going to happen. It's going to take a while. And it takes a while because there's more people who have used drugs and have had that experience with drugs get into positions where they can actually have some say-so about what happens with the drug laws, and then we'll get some change. That's probably going to take at least another generation. But it's happening, and you can see it happening in a lot of different places and a lot of different institutions. There's certainly and a lot of it is driven in the political process because of money. It's because of the resources that are devoted to trying to prevent, drug use, drug importation, and that's really what's driving a lot of the debate, in addition to the people who work in the field who are driving it because of the fact that they feel that you're going to get a better deal for the people it most adversely affects.
Can I turn to Peter and Matt, who haven't said anything so far, and maybe also to Debbie, who are all in the field of really dealing at the sort of street level with all these, with drug users. What would you like to see? What concerns you most about the current situation, Matt? What would you like to see? What would be the one thing, apart from maybe more money, what would change life for the people you meet?
I think hearing what young people have to say. I mean, I'm aware that there aren't, young people on stage tonight, for instance, talking about their perceptions, and I think finding a way to do that in a non-tokenistic manner is incredibly difficult. You have youth councils around the world, and normally they're kind of kids who are normally the ducks of the school. So actually finding young people who are in these situations and then hearing them is a very difficult thing to do. So that's something that I think is important.
Something your organisation could do, isn't it? I mean, you
absolutely.
Would, yeah.
So we're looking at holding a youth drug summit next year. something along the lines of the drug summit, but putting young people at the centre of that in Canberra. But that's an aside. I mean, that's one thing. Like you say, more money. But just looking and looking at this, I'm incredibly painfully aware that I'm the novice on stage here, and I kind of drove here in a sweat of anxiety that I was surrounded by my masters and my heroes, and I'm actually under a little bit of fear right now that I'm going to be yelled at by someone I really admire. So I'm going to be very careful about what I say. But
just stop now. Stop.
But you're right. I should shut up right now. But one thing I do want to say, and this is going back to something that Brian said, and I agree, is all of us are pretty much on the same page. Yeah. One thing we don't do is distinguish between decriminalisation and legalisation, which I think is a really important thing for the population, for the crowd. We need to say this is that, and then we also need to talk about whether we step toward legalisation, because I think we all believe that is a good world to have, a place where there is no harm upon a human being. I think we all agree on that. And I think the drug and alcohol sector in Australia has always been a very bitchy mob, full of wonderful people who can be very bitchy. It's just a fact, and it's something that is actually also a natural thing. It's in any sector, in any industry. Now, one of the things, going back to what Brian was saying, there's a similarity here, and it's not the best analogy, but it's one I think of a lot, which is Occupy Wall Street. Everyone agreed that what Wall Street had done was wrong. Everyone agreed that there needed to be change. But there's this wonderful show on at the moment, I'm sure you're watching it, the Aaron Sorkin newsroom, and in the latest episode, I forget the name of the lead anchor, he just writes off the Occupy Wall Street girl and just says, at the end of it, in his show, he says, you haven't got a leader and you haven't got a message. You're not willing to meet with a politician to make these changes, and therefore you will fail, and just writes her off. And it's really upsetting because everyone believes in it. But he talks to her again, he says, look at civil rights and look at all of these things that have changed in history, slavery. They all had a leader, and they all had a single goal of where they were trying to get to. Now, I think that's what we need.
Are you offering?
No, absolutely not. But someone like an Alex, who is clearly, someone who has been, like you said, harping on about this for a long time, and rightfully so, is a perfect candidate for this kind of role. Where we have a leader who is always the person that we go to for this and say, this is where we're trying to get to. How do we get there, though? And how do we have a debate where we talk about and we message this so the population isn't scared? Is a very... So I guess what I'm talking about is framing.
That's an interesting idea, though, the idea of actually running a campaign to do it.
Well, Australia 21, I guess, is that. But what I would say is how we frame it and how we outline steps and a strategy toward doing this, knowing that politicians are going to be scared what the population think. I think we first go to the population and say, listen, we understand your fears around this. Here are all the experts, here are all the different views. And I guess what I'm saying is Australia 21 has done a lot of this, and I don't think it's something that is unfinished. I think there's now, version 2. And when I think back about my own family's legacy and back to what my family has done, we have had huge successes and huge failures. Ted had wonderful things like the Wayside Chapel, and then he had Life Education Centre, which was a worldwide monster of a thing saying, say no to drugs. And my father had to live under that burden saying, oh my God, this is not going to work. So we know that you don't give up, but you do recognise how you can look at what you've done and say, how can we add on top of that? So I do think Brian's right. I think it's about a message, but I'd also say one leader, not a Korean-style kind of dictator, but someone that where it is a democracy and we all sit at a table, yes, is this the way we're going? Yep, okay, Alex, bring this to the table. This is the person who talks about it, and this is how we illustrate the message.
Good idea.
Okay. Watching the video and hearing the conversation here tonight, at some level it's just exhausting because I feel like I've heard it a lot. So that's frustrating in itself. At the same time, for years it's been the case that if in a public forum, if you put your hand up for harm minimisation or harm reduction, you were on one side and the other side was usually abstinence or say no, and there's this immediate divide which has been so unhelpful. And I suppose the rhetoric from one side to the other is, I guess, more towards the harm minimisation side has been pretty unkind, I think, that these people who don't care about kids and just want them to use drugs, I think it's been pretty unkind. I think often driven by hurt and pain and suffering. And
I think driven by fear too. I think, to be fair, it's driven by parents who are afraid of their kids going on drugs and they want that not to happen.
You're right.
I don't think it's I don't think it's sort of vindictive or
no, not at
malicious.
all.
It's
not
just,
at all.
It is
and in
fear.
fact, I met you, Paul, years ago involved with the Wood thing. That's where I first met you with Anna Wood.
Yeah.
And I have been able for years to share the stage with Angela Wood, because when I'm asked that question, for me it's always been, and it's a very truthful answer, when I'm working with kids, the top of my list is their welfare. It's not, do I have this political position or some other political position? It's what can I do to help this person be happy and healthy and safe? And then we can work together to work out what that might be. And within that, you have the option of harm reduction or harm minimisation or anything else. Having said all that, two other quick comments. My experience right now is alcohol, and it's not so much alcohol per se. Most people who are taking drugs are trying to do it because they want to have a good time. And people get hurt either because it's an accident or because there's a lot of serious stuff going on in their lives and that gets associated with drug use. So we need to do something in terms of this discussion here so that all those punters are actually brought into a place where they can be looked after and respected. And over again, we've created a situation in this country so you can see the impact of legislation and what happens in terms of alcohol. And that climate has changed enormously. We were talking about it a little bit here earlier this evening, and that's really different from what it was years ago. And if we're talking about the legislation, we certainly need to talk about that in relation to the promotion of alcohol. We shouldn't just talk about it in terms of legalisation of another substance. Alcohol is the one that's driving use of alcohol, and the reasons for that, because we've created a culture of use, that's driving horror after horror after horror. And kids who would otherwise be wonderful human beings do things on Saturday nights that they can't even remember, and when they see the footage, are shocked.
Yeah, I mean, as a parent, I think I'd be much more worried about my, 12-year-old binge drinking and doing something very silly. I'm sure he will, something very silly on alcohol than on drugs. I think he's much more likely to do that, and much more likely to get into harm doing that, frankly. Rod, what do you reckon? We haven't heard from you.
Uncharacteristic.
You're going to make up for it now.
Yeah.
So you have to press the button at the bottom.
How's that one?
That's fine,
okay.
Yeah.
I had a couple of comments. The first one is, if we're waiting for the politicians on this one, we'll be waiting a long time. My understanding is that a substantial proportion of the Australian people want reform of laws about euthanasia, and I suspect as the baby boomer generation gets older, it's going to happen whether they like it or not. But they can't read the tea leaves. They didn't read the tea leaves on the GFC or the Berlin Wall going down. They don't appear to even be reading the tea leaves as Old Bar Beach disappears and the houses get swallowed by the sea. Leadership is not something that we've seen a lot of at the state or federal level. How do we change that? Well, I don't know, so I'd leave that to other people. And Alex would certainly know a good deal more about that, I'm sure. The other issue I had in mind, though, was science. Nobody's really mentioned science and evidence. One of the things I find interesting and troubling about, say, watching Q&A on Monday night is that there's lots of opinions, and too many politicians usually, but very little in the way of evidence. When it comes to complex systems, there's a science called complexity science, and there are ways of analysing complex systems. So politicians can claim that if we decriminalise cannabis or have control of supply of cannabis or something, all these dire things will happen. As long as they never trial running it, they can be proved correct or incorrect, doesn't matter, they're not running it anyway, nobody will ever know. Complexity science says that even in fairly deterministic systems where very little free choice goes on, it's often impossible to tell what's going to happen next. grains of sand and so forth will behave in ways that are entirely, within the laws of physics, but you still can't quite tell what pattern they'll form next and so forth. So I think when it comes to issues like whole populations where people can make choices and have different brain chemistry, and advertising companies and Woolworths and Coles flogging their products all over the place, there's a whole number of players in here. It all gets very complicated. The one thing we shouldn't do is keep pretending that the current system is a good system. It's a stupid system. We have plenty of laws about alcohol. We generally ignore them all. We've got huge amounts of evidence about what works in controlling alcohol-related problems. We ignore it all because of corporate profits and so forth, or gutlessness, who knows what it is. So when people say, well, we've got problems with alcohol and alcohol's regulated supply, yes, but we already know that what we're doing with alcohol is stupid and we're asking for trouble and we're getting it. So in fact what we're getting from alcohol-related problems is entirely what the model would have predicted. So,
Gino,
yeah, we need to put a little bit of science into this, I think.
Well, follow on from right about reality. Like, I believe in a drug-free world, and I also believe Clive Palmer will be the next Prime Minister. And I think science will rule policy as well, and you can put all three together.
That'll be the trifecta.
It would be the trifecta.
A couple of thousand to one.
I think Tony and I will probably have a bet on that later. We can get a bet and see what we can get on to that. But what we do all agree on here, I think, is that the current system is not working. I worked in prisons, and a lot of people are dealing with the criminal justice system. What we do with our kids now is not working, and with other people who are using drugs. That we can sell to politicians. Working in Canberra now and working there for a number of years and talking to ministers and even today, by chance, bumped into John Howard, the former Prime Minister, on a flight from Melbourne. And sorry? Well, the thing is that people would, even when you got to Howard, or if you get to any politician one-on-one, they'll acknowledge that they want to do something good. The problem is that we'll argue about whether we decriminalise, whether we legalise, and they don't quite understand what that means. As you said, Paul, they have kids, or they have people in their electorates who have kids, and they're worried about what the impact will be on that. Are you saying it's okay? People always want the best for their kids. We have to get a message to them that they can sell to the public as well, and that they feel comfortable about selling. And one of the clear messages we can tell them now, and we can sell to them, is the current system isn't working. That the focus on imprisoning people or criminalising people puts so much of a penalty on young people. Anyone with a criminal record now for drug-related charges is virtually punished for life, and that is just ridiculous for a young person to have that penalty overhanging their head.
What about engaging someone like GetUp, or trying to interest someone like GetUp in running that sort of a campaign?
That would be good. I agree with what Matt's saying about a campaign. I think we have to, whether it's GetUp or someone else, I'm not sure. I don't know enough about how they work and how they determine campaigns. But there is a campaign needed to educate the public. There's also the adage in Canberra that if the public really wants something, and notwithstanding things like euthanasia and some other things, then politicians are likely to follow that. There's only so long they'll stand in the way of what the public wants. But I don't think we have that agreement in the public that they're really looking at significant change in the drug laws.
Is that something that you feel has been done by the experts in, let's call it the industry, the experts in this area? Have you ever really banded together and tried to get a change in the law I know you, well, Alex, I know you have, but has it ever been a really concerted effort by everyone in the business to change the law?
Yes, there has, in this and many other countries. Yeah. And let's not forget that June the 2nd, 2011, New York City, we had about 20 stellar figures from around the world giving a press conference from the Global Commission on Drug Policy. Former UN Secretary General Kofi Annan, former US Secretary of State George Shultz, former Chairman of the US Federal Reserve Paul Volcker, former presidents of Brazil, Colombia, Mexico, Switzerland, Sir Richard Branson, etc., etc. And the primary message, they said, was the war on drugs isn't working, as Gino and many others have said. So that's really underway. And there are a lot of discussions going privately with all different parties, political parties, and I don't think the situation's in many ways is quite as bleak as people imagine. There are people in all the political parties who want to see the sorts of things we've talked about today, and there are others within the same political parties who have very opposite views. The division isn't between the parties, it isn't between the parties, it's within the parties.
Sure, but I think what Matt was saying earlier is you've got to create a climate where politicians can actually think they've got some chance of selling it. And it seems to me that you only do that by running some sort of a mass political campaign with petitions and something like that.
With respect, that's happening in the United States. Sorry.
Yeah, but I'm talking about here in Australia. That's where laws need to be changed.
The US really started the international drug control system, and has been not the only, but certainly the most important driver of maintaining this system. And opinion is changing very rapidly in the United States. To give you some figures, the Gallup poll, 1969, 12% of Americans supported the legalization of marijuana, which was the question that was asked. That 12% has now gone up to 52%. The 84% were opposed in 1969. The most recent figures are that 46% are now opposed. So there's been a massive shift in the United States, and the Gallup poll isn't the only poll that has recorded those figures. And what's happening in the United States is very important, because just as in the collapse of communism, it was the collapse within the Soviet Union that was just as important as the collapse in the satellites. It's been referred to already. And so the change in opinion in the US politics shouldn't be discounted. And it's not just in the United States of America, it's in the Americas. So we're seeing even more radical changes in Central America and especially in South America. So this is a massive change, and we shouldn't discount it. Will it happen here? Yes. How long will it take? Probably a long time.
Look, I'll go out on a limb here and disagree with one of my heroes who's in a particularly optimistic mood in terms of the change and the general acceptance of drug law reform. Look, my position is exactly what people are talking here. I looked around at the political parties. I looked with great enthusiasm at Alex's Australia 21 report that they're involved in, and with absolute dismay and dejection when Julia Gillard, just out of hand, said, hey, we're not even going to look at the drug issue. That motivated me. I'm 57. I smoked a bit of pot at university. I thought,
didn't inhale.
The laws, I inhaled and loved it, which was my problem, and I did get a degree, but not as well as I could have. But the point is, after 40 years of this prohibition, I think we've got to get a movement, we've got to get organised as a political force. And with total and utter respect in all for the people who've done the hard work at the coalface in this room in terms of supporting families and addicts and young people, the problem now is political. It's a legal issue, and again we're all going to limb and challenge Alex there, who liaises with a lot of the politicians. They don't have one iota of interest in addressing this. They will beat that law and order drum as long as it'll get them votes. And they will beat that drum for their own self-interest at the expense of young kids that will become addicted, of young kids that will die. And to take up and offer Matt an apology, I was thinking terrible things about you because of your namesake, which I should not do because my father, of all things, was a politician. And I do like to think that I'm not drunk, but I'd like to endorse Matt's point there. Just they're absolutely insightful, that we need a unified political body separate from the service industry. That James was brave enough to say that because they're beholden to government funding and their charge is to address the immediate harm, they're not going to go out on a limb and argue for legalisation, decriminalisation, look at the facts. And the facts that you led off with, Brian, are the numbers. 2 million Australians use cannabis regularly. Okay, 500,000 kids, and kids I'm assuming, but they're not, 500,000, 540,000, the same householder survey that Brian Waters quoted from 15 years ago, use ecstasy. You know, Australians, that's about 15% of the population have used ecstasy, and 500,000 use it regularly. That means within the last year. So look, drug use is endemic. And the other thing I just want to try and remind people is that, look, drugs are a problem. Yeah, I was a drug addict. I know drugs are dangerous. But not all people have trouble and dangers with drugs. But the real thing is that prohibition, the attempt to solve the problem, just make it worse and put our kids in harm's way. And that's what, to be perfectly frank, makes me a bit angry.
Brian's itching to say something behind you. Yeah. Hand in the mic. Oh, sorry, Clive in the mic. Brian first and Clive afterwards.
Sorry. Look, I'd just like to say, I don't disagree with much of what's been said here, but the point that I was trying to make first up was made a bit simplistic, perhaps. I don't disagree with a lot of what's being said here. But what's being said here is the reason we're not getting anywhere, is because everyone's using different terms, prohibition, decriminalisation, legalisation, that no one really knows what everyone else is talking about. It means different things. What I was trying to do is make a simple point. Where I talk about coercion into treatment, I'm not talking about things like you get a criminal conviction or record against your name if you're put into treatment. What I'm trying to do is say we need to use language that doesn't frighten the crap out of politicians, or it doesn't make them think that everyone will see them being weak. In other words, if you choose your language carefully, you'll get a lot further. The fact tonight we've heard the war on drugs has failed. We're talking about Australia. Bullshit. There has never, ever been a war on drugs. If we wanted the drug problem solved in Australia and we wanted a war in drugs, we could do it. We would put an army together, we would call the army together tomorrow and say, here is about 200 people, go and shoot them. If it was a war on drugs, that's what we'd do. There has never been a war on drugs in Australia, and that sort of language doesn't help.
Well, I think that's a bit extreme, frankly. And there is a war on drugs in South America, and it certainly hasn't worked. You know, they're forever bombing the Colombian cocaine cartel. It doesn't do any good at all.
If we're saying we're having a war on drugs, I think people take it literally. There's a war on drugs,
which there is.
Well, we're not fighting it according to war principles.
Well, I've had guns pointed at me. So, you know, there is a war out there. There is damage. There are people dying.
Debbie.
I've lived with, my son's used heroin, he started when he was 18, and at that point it was very chaotic, and we had all the stigma as a family because we didn't understand. But as soon as a family we were educated, and through Tony and Sandra, then we actually were then empowered. And then, so I've been able to speak a lot in my own society, in my own community, about that it's not... So at Chris's worst time, he was like working full time, stealing at night. Like he had 3 jobs. He was working all day, stealing at night, and he was doing community work all weekend, Saturday and Sunday. You know, and he was getting community work after community work. He was never, ever, ever offered, like he's got hundreds and hundreds of charges, you know. But you know, and he worked all the way through that. And but at 24, he's starting to like learn a lot more about himself, and it's as a family, it's having patience to allow him to grow up. And but unfortunately, he ended up with an addiction. But if he had been able to, when that addiction happened, if he had been able to go to the chemist and get his heroin each morning and night, there wouldn't have been much of an issue. His issue wasn't the heroin. His issue was the stealing and the carrying on that he had to do in the evening. You know, and he has worked in the community for all those years, and because we put up our hands, said this is what's happening in our family, and became stronger about it and more resilient, that's the part that has empowered my whole community. And you know, so people don't stigmatise our family at all, you know. And you know, people go, oh, quickly get him into a 28-day program, or do this or do that. For the 28-day program, what's helped him is us being educated, and for him to be allowed to grow up, and you know, and slowly as the years have gone on, his use of heroin has slowly stopped. And you know, I mean, at his worst, he was stealing, and when stealing didn't work, he was dealing, and when he was dealing to, you know, the head of a nursing association, a doctor, But when we became really open about it, and he talked to us about it, he had people coming and going, and they were like a teacher, all sorts of people in our community. So when we normalised it in our family, it became something very different. And now he dabbles a little bit, but hardly anything, you know, and he's got control over something that... And his biggest supporter was the chemist.
We're getting close to 8 o'clock when we're supposed to finish. I'd like to ask 2 more questions, and if there's other things people want to say, then feel free. But first question I'd like to ask is whether there's any one drug or category of drugs that you would not want to liberalise or decriminalise or whatever the right word is. I mean, the one that comes to mind, having seen a couple of people affected by it, is ice. And I guess maybe some synthetic drugs. Is there anything you would exclude from that? A desire to liberalise? Ice is one? Yeah. That seems to me to be a...
Arsenic.
Arsenic. Yeah, but what I'm asking is, are there something... Clearly cannabis is much easier one to take a decision on than something like ice.
You'd highly regulate ice. Ice scares the hell out of me. The psychosis, the paranoia, a particularly dangerous, damaging drug. A friend of mine's son is on it, and the aggression and the violence. But nonetheless, prohibition, the criminalisation, the marginalisation, the prejudice associated with the prohibition doesn't help the families or the kids with the drug problem, whether it be heroin, ice, cocaine, marijuana, or a strong coffee habit.
Alex?
As with any other very complicated question, it's important not only to answer the questions, but to take the questions in a systematic order and answer them one by one. This is a very difficult question, and I think it's important to answer it in terms of principles before we get into specifics. What I mean by that is that it took us 30, 40, 50 years to establish the international drug control system, by shorthand is referred to as prohibition. 3 international treaties, a network of UN agencies, a whole series of domestic laws in 190 countries, that sort of thing. That took a long time, and dismantling that system is also going to take a long time. It's not going to happen overnight, and it's going to occur in a stepwise fashion, in an evolutionary fashion. Most change is evolutionary, little change is revolutionary. So it's going to start, I think, with cannabis, and the important principle here is that systems that are heavily reliant on drug law enforcement encourage more dangerous drugs to push out less dangerous drugs. So when opium smoking, for example, was banned in Asia, it disappeared within 10 years but was replaced, unfortunately, by heroin injecting. And there are many other examples of that. So the likelihood is that when we move from a system, a very punitive, harsh system, to a system which is more liberal and more regulatory, that less dangerous drugs will push out more dangerous drugs. So I think the answer to your question is when we start this process, the really dangerous drugs will disappear and will be replaced by less dangerous drugs. That's a very important principle.
That's very interesting. Brian, yeah.
Yeah, look, I tend to agree largely with what Alex has just said. Just one thing though, I'm perhaps unique amongst people here in that when I've raised these issues publicly, I've had an opportunity to see a full board of calls ring me up and tell me I'm peddling drugs, I'm pushing the drugs. You just want people to take drugs, don't you? And that's the initial response, especially when you use the term legalise or decriminalise. The impression is it's open slather. What I did find though, when I started using terminology like control, regulate and tax, and you go through the argument in a very logical and coherent way where you outline all of the negatives, not just to the individual user, but to the society as a whole, to the planet, to security, terrorism issues, etc. People begin to understand. It's not an impossible message to get across. It depends on what it is entirely you're trying to define. What is the problem? How do we define the problem? What outcome do we want from any changes that we make? And to be cogent and it took probably 3 or 4 years of making the case publicly and being known for making it publicly, where I had people eventually ringing up and saying, you know, I've been thinking about this in the terms that you've been putting it, and I've actually come to the conclusion that you're probably right, the way we're doing it. Now, again, people need to understand that the 80-odd% of people out there in the broad community have never seen marijuana, let alone smoked it, have never snorted cocaine, have never met a heroin addict. What they see, how they judge these substances is by the worst of the people. It'd be like saying everybody who drinks alcohol is an alcoholic, and that was kind of the analogy I used to use. In terms of government, there's no impetus amongst the people to do this. The ordinary Joe citizen out there going to work and paying his taxes. The only way this is going to happen is to make a case to government for revenue. The taxation capacity, the ability to tax these substances in a controlled and regulated way, and the amount of revenue that might be generated to governments all over the world who are struggling to fund hospitals and public transport and infrastructure, etc., all the things we know about. There is money there to do it. When you put that argument to an ordinary person, I think, on the one hand, would you prefer to see hospitals and roads and more police stations and a safer street? Would you like that? The alternative is very rich criminal gangs who are quite happy to pick up a gun and shoot the opposition to control a particular patch to supply ice or heroin or whatever it happens to be. When you put it to them in those terms, it's a no-brainer. It's an absolute no-brainer, even for people who've never had any direct experience with drugs other than perhaps having their house broken into or their car stolen. And I just think that the argument that's going to swing politicians here is not the morality of it, is not the health of it, is not the logic of it, is not the correctness of it. It's the revenue. It's the only thing they really understand.
40 years ago, you could be thrown into jail for being gay. At the same time, we were putting people with mental illness into lunatic asylums and locking them away forever. And our disabled people had very little rights and services. Indigenous people in Australia weren't even regarded as citizens. All that's changed, but it hasn't changed in terms of drug use and drug users. The reason that I think those things were so scary was people did fear them, and I think it's the same with drug use. People fear it. We have to have people stand up like the people who were gay did, like the people with mental illness did, and I think, in the last 16 years, one of the things that has happened is I've been able to present an ordinary person's story, and I think people like Debbie and a lot of other people, Annie Madden who featured in that video, there's nothing to be scared of. And I think I'm with Matt Knopfs. We have to have a campaign, we have to get people out there telling stories. I don't know if it needs a single leader, I think it needs probably a lot of people. But we have to have this campaign. I think that's crucial. And one of the things I would like to see very soon is a national drug summit. The one change that happened in New South Wales was after the new 99 drug summit where we got the injecting centre. We need a national summit. Bring everybody together.
I think we should leave it at that, frankly. I think that's a very good moment to end after those two contributions.
Interesting to get a whole perspective from the legal, policing, medical, youth workers, whole gamut of views.
I felt very clearly it was reminding me that change is possible and that we've seen those changes in other areas of social injustice in the last decade or few decades, and there's no reason to believe that we can't.
FDS this evening and this day, not just this evening but the whole day, has been wonderful from that point of view. It's showing there is life, and while there's life and hope and determination, you can overcome any obstacle.
Oh, look, I think it's been a great success in terms of the panel being so articulate, so brilliant in what they've had to say. I'm looking forward to getting the film out and hopefully making a few people take notice and realising that we're all ordinary people and we're all working together trying to help each other.